Hey, in this video, I'm going to tell you the 12 reasons why you might benefit from an online knee arthritis recovery program. This is essentially my whole brain. This is how I treat people here in the clinic with knee osteoarthritis. It's all packaged into a program that you can move through methodically and you can get long-term recovery for your knee arthritis problem by going through this program. So here's reason number one. You don't believe you're getting better with your current knee arthritis treatment. You may have already tried some treatment for your knee arthritis in the past, or maybe you're going through some treatment right now. It may involve medications, injections. You may be going to physical therapy or getting some other type of treatment for your knee arthritis. And maybe that's just not working out for you like you hoped. You're not getting the improvement that you expected, or maybe you're getting worse. This program is different because it addresses the root problem rather than just the symptoms, as most treatments do. Medications, injections, even regular physical therapy is mostly symptom focused. It's focused on treating the symptoms rather than getting to the root of the problem. And if you're just stuck treating the symptoms, the root of the problem might actually be getting worse. And this is why knee arthritis tends to flare up again and again as time goes on, because the root problem has not been addressed. Reason number two is that you're getting the latest cutting edge information to heal your knee arthritis problem. Most physical therapy clinics provide their patients with basic information to just treat the symptoms. And this is the type of information that they get in physical therapy school. And really they're best at helping people that have just had a knee operation. That's what most physical therapists do that work in clinics. They help people recover from knee surgeries. But if you're watching this video, you probably have not had a knee surgery yet, like a replacement surgery for knee arthritis, and you're looking to avoid a knee replacement surgery. You want to make sure that you do the right things so that you can move away from that. This program offers my expertise as a specialist in helping people avoid surgery. It's got a different thought process than what you'll find in typical physical therapy clinics. And if you've ever watched any videos here on our channel about knee arthritis, you'll see that I just speak differently than most physical therapists as well. That's the type of information that we've packed into this knee arthritis recovery program. Reason number three is that you can get better in the comfort of your own home. I run a clinic here, and I can tell you we have to sanitize it, clean it up every day. Clinics can they just get unsanitary every day with use. And if you're looking to make sure that you're staying healthy, you can avoid having to go to a clinic by doing a program like this. And not to mention, you don't have to worry about your appearance or being seen by anyone. So that's another advantage of doing this program at home. Reason number four is that you need minimal to no equipment whatsoever to do this knee arthritis recovery program. You can probably get through the whole program without purchasing any equipment whatsoever, but I do make some suggestions in the program for some equipment that might help you out, but it's up to you to determine if you need it or not. I'm big on using little to no equipment because for the long term, you don't want to have to rely on any sort of equipment to keep you better. The body is designed to take care of itself. If you put it in the right environment, you really don't need anything else but the right strategy and mindset when addressing your health. Reason number five is that this may complement what you're currently doing already. Because maybe what you're doing is helping you, you're getting benefit and you're improving in your knee arthritis, but you're looking to fill in the gaps and make sure that you have all the knowledge possible so that you don't have this problem recur over and over again, so that you can truly get long-term relief from your knee arthritis. Going through this knee arthritis recovery program can give you certainty that you're doing everything you need to do to take care of your knee health for the long term. Reason number six is that you can prevent your knee arthritis from worsening. The healthcare field as a whole blames knee arthritis on age. Any kind of arthritis, they say that it just comes on with age. But that is a huge lie. You have to separate age and time. Problems that fester, things that are not taken care of, tend to get worse as time goes on. But it's not necessarily age related, because we have people here in the clinic, we have people that go through this type of program all the time that are going forward in time. They're aging, but they get better. So how is this age related? It's not out of your control, and it's not just as you age, you're going to get worse and worse over time. It's if you're not doing the right things over time, then it gets worse. So that opens up the possibility for you to improve your knee arthritis so that it doesn't worsen over time. Reason number 7 is that there's little to no pain at all in going through this knee arthritis recovery program. The no pain, no gain advice is really bad, especially when treating knee arthritis. The only time I recommend a no pain, no gain mentality is if you're recovering from a surgery, because you're just going to have pain after recovering from a surgery, especially if you're not taking pain medication as you should. It's going to be painful and you have to get some movements in. But if you're avoiding surgery, you have not had surgery, that's what this program is for. It's to avoid having a knee replacement or having other knee surgeries because you're suffering from knee arthritis. Because you're avoiding it, you really should not be running into many painful situations. In fact, we advise people to stay out of those situations because they tend to increase inflammation and make your knee arthritis worse in the long run. We talk about all of these limits in the program and discuss how to get around them and how to manage them so that your knee arthritis can get better as fast as possible. Reason number 8 is that you have internet access and a device to watch videos from. Besides that, you probably just need a pen and paper, something to write notes with, and you'll benefit tremendously from this program. You don't need any special software. You really don't need anything else but internet connection, a mobile device or a computer. A tablet will work as well, and you can get going on addressing your knee arthritis. Reason number 9 is that you don't have to travel anywhere. You can save on travel costs, avoid big crowds, and avoid putting yourself in situations where you might be exposed to unwanted illnesses. Illnesses are often found in medical facilities, and so if you can avoid that, all the better for you. Reason number 10 is that you don't want to rely on pain medications or injections to manage your knee osteoarthritis. Now, conservative treatment for knee arthritis versus non-conservative treatment for knee arthritis means you're taking pain medications either by mouth or you're getting them injected into your knee, or you're doing physical therapy treatment. That's really what conservative treatment is. Non-conservative treatment also means invasive treatment, where they're going in to do a surgery for your knee problem. The first line of treatment that many doctors will give people with knee arthritis is medications and injections. And where people get stuck on this is they feel better with them because they take away the pain, but it is just short term. The medications only have an effect for so many hours. Injections only have an effect for so many weeks or months. There are side effects to taking medications and getting injections. These side effects may be short term, but they could also be long term. And really, these treatments are just band-aid treatments. They're not addressing the root problem of knee arthritis. So this is why the healthcare field believes, by and large, most of the people in the healthcare field believe that this is an age-related problem and that there's no solution for it. But what I'm telling you about here, our knee arthritis recovery program, addressing the root of the problem, it is just not common knowledge for the healthcare system. Now, I believe you can use medications and injections strategically, because if your pain is so high that you're not sleeping very well, you're not moving very well, you might benefit from taking pain medication or having an injection in order to get better sleep, because you heal more when you sleep. And you may be able to move better so that you can do your daily routine, your tasks that you have to do, go to work, if you're in a little bit of relief. But what you need to make sure you do if you're on a pain medication and it's working for you is also be working on the root problem so that you're taking advantage of the time that you're getting relief from the medication that you're using. If you're not working on taking advantage of that time that you're on the effects of the pain medication or the injection, then you're putting yourself at risk to just be relying on those medications over time, not really addressing the root problem. And that root problem really just grows over time. Reason number 11 is that you want to avoid getting a knee replacement. This program is truly designed to do just that. You can avoid getting a knee replacement in most cases of knee osteoarthritis. Now, healthcare is not a perfect science, and not everyone is going to be able to avoid having knee replacement, but I'd estimate that over 9 out of 10 people will be able to avoid having a replacement surgery. And going through a program like this, where you're addressing the root of the problem, greatly increases the chances that you'll feel better in your knee, feel more mobile, better able to move around, especially in the morning when people get stiffness from knee arthritis. All those things should diminish, they should decrease, so that you can be more active, get right up out of bed without your knee slowing you down so much. And most importantly, it won't progress as time goes on, so that you can hit the next decade of life with your normal knee and not a replaced knee. Now, reason number 12 is you want to prepare for a knee replacement in the future. Now let's talk worst case scenario. Let's say you're 100% certain that you're going to get a knee replacement. It's just a matter of time. It would still be wise of you to go through the knee arthritis recovery program, because that root problem that I've been talking about that got you the knee arthritis does not go away after you have a knee replacement surgery. The root problem involves muscle imbalances, or in other words, weaknesses in some areas and overdominance of muscles in other areas. And if that's not addressed, even though you have a knee replacement, you're going to be affecting some other body part. Maybe the actual knee replacement itself, those can be damaged and loosened over time, and that might require a revision surgery where you have to go in and have another knee replacement done essentially to make sure that your knee is healthy so that you can move and do everything that you want. A more common scenario is the other knee starts to get involved because of that root imbalance, that root problem that is still there. And another situation is the hip joints and feet and ankle joints can also be involved if the root problem is not addressed. So going through this type of program is very wise to make sure that you're cleaning up all the problems so you're not having to deal with these aches and pains and possible surgeries as you move forward in life. Hey, this is a paid program. I put the link in the description below, and I've also put the link to our playlist of all our free knee arthritis videos here on YouTube. So you can go down in the description and find that as well. If you have any questions, if you have any comments, drop them in the description below. Give this video a thumbs up, and I'll see you in the next video. Bye-bye.